Good morning and welcome to Roundhouse Rundown. This is episode 21. We're back. We were here a couple of weeks ago with Dr. Adams, and we're back here again with Dr. Adams talking about, moving on from the medical malpractice. And we'll be talking about how we can recruit doctors. We'll probably touch a little bit on the malpractice because that actually ties right in. If we don't fix that issue, then we really can't fix how we recruit doctors, because that's one of the things that keeps doctors from coming here. Isn't that right, Dr. Adams?
Yes, I think that is really the main issue, but there's lots of other areas that we could improve upon.
So kind of to me, if we don't fix the medical malpractice, then probably everything else we talk about today is a moot point, because you're not going to be able to fix anything else when doctors can't get medical malpractice insurance, because they can't practice without medical malpractice insurance. So that's one of the areas we absolutely 100% have to fix it. Otherwise, we're going to lose our docs. Now, they may be able to stay in hospitals, but there are so many specialties that you just can't get through a hospital. And it actually can cost a lot more for patients and for medical programs to your insurance programs to go through the hospital. And so we really need to fix this issue. What are some of the other areas we see? I know we have a loan repayment program, but it's kind of, compared to the other 49 states, it's pretty weak, right? We kind of pay a little bit of money every year, but we're not paying off those loans, which as most other states are.
Correct.
Do you think that can be a really effective tool?
I think that would be huge. So the cost of obtaining a medical degree has increased significantly compared to when I went to medical school. And now some students can come out with, many students, $500,000 of debt. I would say 250 and above is pretty routine to be expected. And so to start out your career with such a huge debt and so many years of not having worked, right? So a physician doesn't start their career and earning capacity until they're in their 30s or mid 30s. And to start with a debt like that, it can be difficult to get ahead. And so I think loan repayment would be perfect, and something more like IHS, where for 1 year of served, it would pay 1 year of medical school, so 4 years in an underserved area. And as you know, all of New Mexico is underserved when it comes to healthcare, even Bernalillo County, because we take care of patients from all over the state. So even though we sometimes on paper appear to have enough specialists in Bernalillo for our county, we don't have enough for the whole state, and we're taking care of patients from all over the state.
Right, because honestly, especially from the counties closest to here, but you have people that will come up from Doña Ana County to be seen by specialists
from everywhere. We see people from Taos, from Gallup, from Zuni, all over.
Right. So
Tucumcari.
Yeah, Sandoval County comes here. All the local counties come here, but then you have from the entire state. It's kind of like the VA system kind of has that same thing. If you're needing any kind of specialty, now if you're in the southern part of the state, they're going to send you to El Paso's VA, but otherwise you're coming to the VA here in Albuquerque, and that's just to get any kind of specialty treatment. That's what you have to do. We see the same thing in our general care. We need a lot more doctors. Just the number of shortage is just staggering. You just can't imagine how many doctors we're short in the state. 2,500 just family practitioners, and that's not including any of the specialties or any of the other fields. That is just, massive. And UNM's our only medical training school that trains regular MDs, and they don't have that many slots to be able to make up for that shortage that we have. So we're going to have to recruit doctors out of other programs. How are some ways that we can do that? Can we expand the residency program to get more residents here and hope they fall in love with the state? What are some things that you think we can do to bring more doctors from other programs?
I think if we could train more residents and medical students, that would be great. And I think we have to figure out why the ones that we're training aren't staying. So I believe UNM, it's less than
I guess,
40%.
40?
It's
Yeah, I
about
think it's about
40%
40%.
of graduates from the medical school stay here. So I'm not sure exactly all the reasons why that is. I mean, I can venture a guess on a lot of them. One is getting paid higher in other states. Two, lower liability in other states. Practicing when you practice in an underserved area, it is much more difficult because you don't have access to resources that you need. And so that means that for this same problem, the physician has to work so much harder, trying to access care, trying to get something approved, prior authorizations, let's say. So the poorer, the less resources, the harder it is on the physicians to try and get what your patient needs.
And prior authorization has been an issue we've kind of tried to deal with in the legislature, but it seems like somehow the insurance companies get around every fix we try to do in the legislature. That's still a big issue, and that may be a reason why people aren't coming as well. It's just so hard to get the treatment that the doctors say, my patient needs this, and then you got an insurance company that says, well, we don't really want to pay for that.
Right. It's a huge problem. And, in our practice, we have 4 or 5 employees, full-time employees that are working on behalf of our patients to get medications approved, to get procedures approved, to get x-rays approved. And then on top of that, it's still often, there's a point where it's called a peer-to-peer, where it requires a physician to call and speak with somebody who's usually in another state, who's not technically our peer. Often it could be a gynecologist talking to me about a GI problem. And they're gatekeepers, basically. And I think that many practices don't have the resources or the manpower to do it. And there was a study that I was reading that talked about what are some of the factors that would lead a primary care physician to sell their practice, or not sell, you can't sell, stop being an independent practitioner and become employed by a healthcare entity, whether that is some sort of corporate medicine. And the amount that this study cited was $10,000 salary increase per year, $10,000 salary increase per year. That seems that could be, that there are ways to compensate for that through things like less headaches, less administrative burden with prior authorization, improved Medicaid reimbursement, so that we could, we need a healthy, independent, private practice community. We need a healthy, strong university system to train our new physicians. And, a university system is supposed to be the tertiary care center. They're supposed to take care of the most complicated of the complicated. And the academics are to train our new physicians to either remain in scientific endeavors and education, or to go out into the community. And then we do need hospitals, and we need hospital employed docs who are there 24/7, such as pulmonologists and hospitalists that are internal medicine doctors. So we need a healthy, all three. And it seems to me that in New Mexico, all of those sectors are underserved. We don't have enough of all of it.
Yeah, absolutely. We have shortages in every area of medical for our state, up and down. And one nice thing about the loan repayment program we do have, which needs to be expanded, it needs to be grown to where it actually pays off those loans, but it is open to all areas. So dentists can get it, a dental hygienist, techs, radiologist.
That's great.
All of those fields, any field within the medical sector can actually get that. It's a federal and state program. So the federal government puts money in, the state puts money in, and then they pay that out. I think the big problem with that, which I think is one of the greatest ways we can entice doctors in, and that's what a lot of other states are doing, is to be able to bring in. One of the other things that some states are doing, a few of them now, some states like Florida don't have this issue because they don't have an income tax. But some states that do have an income tax, that for doctors, they actually waive the income tax for the first like 3 or 4 years that they're practicing in the state. So while they're trying to get their medical, so they're paying them to help get their loan-free payment, plus they're exempting them from income tax for a few years. Do you think something like that would be beneficial? You might like that for you as well, but
I'm sure that could entice people, yeah, especially people with large loans.
Mm-hmm.
Yeah,
so like you said, I mean, there's a huge expense going through school. I mean, it is crazy expensive. UNM is one of the lesser expensive medical schools. I think you said it's around $20,000 a year, but there's others that are 90. There's some that are over 100.
And that's just tuition. So once you add living expenses and books and fees and all of that.
Well, and I know when I went to college, the books and fees were almost as much as tuition. And so sometimes those books and fees can just really, make that cost just skyrocket. So, I think it's not all just cost. It's about, there's just a lot of things we need to fix in the state, but there's only certain things that we can address. As far as the medical field, those things that we can fix, the medical malpractice insurance, helping take care of those things. We have a lot of, like you said, the whole state is underserved, but we also have some very rural areas in our state. Some beautiful areas like Taos, you had mentioned before, but it's really rural. It's not, some people like my wife, she won't live anywhere if she's not at least, if she's more than 10 minutes from Walmart, she's not living there. And so that's kind of our rule when it's looking, when we look to move somewhere, we got to be within 10 or 15 minutes of a Walmart, or my wife's not going to live there. But, how do we, can we, do some things in those communities? I mean, Taos is a very expensive area to buy a home, but it's very rural. So, are there ways that we can help with housing on those types of issues, or how can we entice those?
So I think housing, low interest loans for housing. I know that I believe that there has been legislation about helping physicians start talk about helping physicians start a private practice in a rural area, because a lot of these rural areas don't even have hospital systems. Let's say, Presbyterian or UNM don't have a foothold in these rural areas. And so to just go and, hang up your shingle as a brand new physician is quite difficult. And so I think having, business loans that low interest business loans would help, or funds to help with housing and setting up a practice would be very helpful. It's daunting with the regulation that there is now and the oversight that is just, it is very difficult for small independent practices to form. So help with that would be good.
And, a lot of us, with our primary care, we really are looking at wanting, that has always traditionally been more of an independent, right? So we would get our doc, and, we'd have our doctor that we would go get taken care of. And then if there was the doctors, would say, well, I can't really take care of this because, this is more of a specialty and I'm not in that field, because they're just general, not just, but they're general practitioners. And then they're going to refer you to the other field. And that may be when you go to, a bigger clinic or to a hospital. But now all the doctors are being swallowed up by the hospitals. Mm-hmm. And it's really hard to even get a primary care doctor. It took my wife 7 years of waiting because she would get one assigned, and then before she could even go to the first appointment, that doctor had left. And
I'll second that. I'm in the same position myself right
now. So she did finally get one just a couple months ago so that she could start being treated. And so she's got to do all these, tests that haven't been done for 7 years that, we're at the age that we have to start doing those. And so, those are some of the things that get dropped. And then we have an increase in health issues because of COVID. And during COVID, people didn't get their, colonoscopies that they needed or their mammograms that they needed. And now, they're just starting to get those back in. And so you've got, health conditions that weren't there from that. So we have a lot of work we need to do in New Mexico on healthcare, and we're just starting that discussion in our state. Um, I think we've got to pull a group together that can really sit down and what are some of the legislative changes that have to be made. And that's where I'd like to offer some of my services is, what are some of those legislative changes we need to make that we can then go back and work with, trial lawyers we're going to have to work with on the med mal. We're going to have to, or we're going to have to get the will in the state to say, well, whether or not you agree or not, we've got to fix this because we all have to have doctors. Honestly, I can live without trial lawyers, and I have a couple of friends that are trial lawyers, but it's really hard for me to live without doctors. I can't do that. And so, and I'm not saying we should have to live without lawyers. They have a role as well, right? Not every doctor is a great doctor.
Agreed.
And in fact, I think one of the problems is as we make it harder to practice here, we end up with some of those doctors that aren't great doctors coming here, that maybe they're not able to practice in the state they were from anymore. Or maybe they've got a few too many malpractice insurance suits over there. And so they're coming here, if we're getting any at all. We want to have the best doctors in New Mexico, as we have such an aging population, and we really have a diverse population when it comes to health issues and other things. A lot of cultural issues that play in, genetic issues that play in our state, that we really need to have great doctors to be able to deal with. So I really thank you for helping us get this conversation started. And hopefully we can deal with some of those issues and pass some of those bills. Did I miss anything? Do you have anything else that?
Thank you, Senator Brandt.
Well, thank you so much, and thank you for letting us do this in your practice here today. And what a great facility, beautiful facility that you have. One of you is probably going to be seeing my wife fairly soon because I think she's having to get some of her tests done here.
Great.
But we just really appreciate. I really appreciate the doctors that I have. I suffered for years with pain issues. I've actually been wheelchair bound before.
Oh my goodness.
And because of the work from the doctors at the VA, within the last couple of years, I've actually gone from using a walker to using a cane to not using anything.
Wow, that's fantastic.
And so I still have pain, but it's not to the point anymore that I'm having to use an assistance device to even be able to walk. And so that's because of doctors. It wasn't because of anything I did. And so, really appreciate what doctors do for us. And thank you for your service to our community. Thank you for being willing to make the sacrifices to go to school forever, or at least it feels like it, right? To be able to get those expertise to be able to take care of our medical needs. So I just thank you to all the doctors out there that serve our community. And I specifically thank the doctors that have served me through the VA. So thank you very much. To wrap up, just really appreciate everything. And you joining us today. If you have any comments, please go to senate40@gmail.com. That's my email. If you want to get involved and help us to be able to change some of these things in the state of New Mexico, just email me there, and we'll start getting more information out to you. Also follow us on Facebook at Senator Brandt. You can follow Senator Brandt, or just our Senate Republican Facebook page. It should be on your screen for you to be able to link to that. Follow us. We do these every week. Keep up on the issues that are affecting the state of New Mexico, and then how we can fix them as a legislature. We'd love any ideas that you have for future shows. Just either email us or comment on the Facebook page. Thank you very much. Have a great day.